Hey, 𝗙𝗵𝗁𝗁𝗁 here, and in this video I want to talk about the three things you want to be checking if you have a stubborn hamstring pain patient whose pain keeps coming back, or they just still have this niggling symptoms, especially as they get up to top end speed. So hamstrings, I've certainly flared a lot of hamstrings up over the years, and it was only until I got that structured step-by-step system that I really started to get confident with hamstring tears. Now, with hamstrings, what we want to do, especially with the acute phase, is obviously the hamstring needs to heal. Okay, so again, yeah, we can optimize the healing process, but ultimately Mother Nature has to do its thing. But what you want to be doing in the first few days is you want to be undoing some of the motor adaptations that may have contributed towards the hamstrings maybe overloading or getting themselves in a position where they can't tolerate load well. Okay, so when we look at the top three tissues that we want to be considering, to help the hamstring during gait, we want to be looking at this. Okay, so again, this is a nice study here that shows the effective speed and influence of individual muscles on hamstring mechanics during the swing phase of sprinting. Okay, so when I've got a hamstring tear, I'm looking at all these things. So I go back to the injury history of the patient. I say, okay, what in the body is maybe not doing its job that maybe contributed towards the hamstrings having to do too much work. Okay, so I'd spend 20% of my time with the hamstring. We need to let it settle. We need it to get it strong again. Okay, and as I said, time itself would get the hamstring strong anyway. Okay, now obviously that's not ideal, but you know, if we left it, and you know, Mother Nature would take care of itself. But we want to be spending 80% of our time on the things that maybe weren't doing their job, that maybe contributed towards the hamstring doing too much in the first place. Okay, so one of the key things I want you to look at here is the influence on the right side biceps femoris. Okay, so the right side hamstring is influenced by the ability of the left internal oblique to lengthen. Okay, so again, as I'm sprinting and my rib cage moves towards my right leg, my left internal obliques have to lengthen. Okay, so that's very, very important. You want to make sure that the left internal obliques can lengthen. Okay, so if I just bring up a muscle of motion video here, you can see the internal oblique is going to be around here. Okay, so here we go. Okay, so you can see as that rotation is happening, it's going to be the internal obliques that are going to be angled this way are going to have to lengthen in that movement. Okay, so that's going to impact then the hamstring as we go through the heel. The heel as it's about to touch the floor. Okay, so that's one of the first things, and then we need to bridge that gap so that as we get that loading well with the hamstring, we need that to go at high speeds. Okay, so that's one of the first things. The next thing that we want to look at is the ability of the adductor magnus. Okay, so the adductor magnus, it's obviously going to be lengthening as that foot's about to hit the floor at heel strike also. Okay, so the adductor magnus lengthening, or the ability of that adductor magnus to lengthen and tolerate load as the foot hits the floor, is also very, very important. So that's the second tissue that I really get the ability to tolerate load well. Okay, so again, when you're doing your hamstring bridges, what I like to do to get the adductor magnus as well is actually just abduct the leg as far as I can with a bridge and get the patient to do essentially an end range hip abduction bridge. Okay, that's really going to get the medial hamstrings and the adductor magnus tolerating load well as well. Okay, so if we get the left internal oblique to lengthen, we get the right adductor magnus to do more, that's then going to help out the hamstring massively. Okay, then the last thing that I like also to look at is the pelvic floor as well. Okay, so again, as I'm going to heel strike on my right leg and my torso is going to rotate towards the right leg, we're going to need a lot of mobilization of the pelvic floor as well. Okay, so that pelvic floor is going to need to lengthen as that foot is about to heel strike. Okay, so again, the adductor magnus and the pelvic floor, that's going to share a fascial continuation. Okay, so again, it kind of makes sense that we want that adductor magnus to lengthen. We're also going to need the pelvic floor to lengthen as well, because that sacrum, as my right foot is about to heel strike, that sacrum is going to go this way. Okay, again, as my torso twists to the right also. Okay, so again, I'm going to need that lengthening, that space between the hip joint and the sacrum to mobilize as well. So they're the three things that I look for straight away with a persistent hamstring case. Okay, we want to optimize all those tissues to give the hamstring the best chance to be able to do its job, no more, no less. Okay, so 20% of my time will be on the hamstring. You can still do all your Nordics, your bridges, whatever you do, whether you're a Nordic or you're not a Nordic person. that kind of debate doesn't interest me too much. Okay, again, it takes 2 minutes to do Nordics, okay, to tick a box. A lot of the Nordics anyway are getting the medial hamstrings, okay, which is going to help your adductor magnus anyway, okay. So that's going to be one thing. You're going to spend 20% of your time on the hamstrings. I went off on a tangent there. And then we want to spend 80% of our time optimizing everything else so that everything else can do its job as well. And then obviously the piece of the resistance then is we need to take the patient through a graded exposure program. Okay, so get really clear on their injury history, what isn't doing its job, that if it did do its job, okay, what is the lead domino, and then once we establish that, then we need to take the patient through a graded exposure program. Okay, so if that makes sense, just say yes, makes sense in the comments below. Okay, if you want some help with this, if you want to look at the body as a whole, help people who fail traditional approaches by getting the things that weren't doing enough work to do their work in a very simplistic way, just say yes, please.